Hi everyone, I'm Namita Jain, a wellness specialist and a wellness author. I am at Bombay Hospital in Mumbai and I'm in conversation with Dr. Rajeev Nerurkar, a leading ENT surgeon. Doctor, a lot of children suffer nosebleeds and then there is panic at the home sometimes. So when a child is suffering nosebleeds, what does a parent or a caregiver, what should they do to prevent this?
So one is that the caregiver, when the bleeding starts, I think that's a different care that you need to follow. You need to just pinch your nose, and you actually need to make the child sit upright, bend forwards, and pinch the nose, and not make the child actually lie down. Uh, then you apply ice if it's possible, and the more important would be the prevention.
Yes.
Prevention, you see a lot of children actually picking the nose very often. So I think that needs to be prevented. Cut their nails so that there is no chance of an injury inside the nose. Not to forcibly blow the nose. That will prevent a lot of bleeding instances. And if there are some blood issues in the family, those need to be tackled beforehand.
Do you think excessive, playing in the sun or being out in the sun can cause nosebleeds?
Yeah, you're right actually. Sun as well as extreme cold, both the things can actually affect bleeding and cause bleeding in the nose. So both these things to be so, when it's very hot and more so dry, then you need to lubricate the nose by saline sprays and putting paraffin in the nose, or even simple olive oil in children's nose also works very well. And when it's extreme cold, same things, you need to keep the nose a little moist, not let it dry, and stay away from extreme cold. Try to stay yourself warm.
And when do you think it is important for a caregiver to visit a ENT specialist like yourself, or is it when they have nosebleeds, or is it not required? What do you have to say about this?
Well, if the bleeding is a lot, that is one thing that you need to definitely go to a primary care physician or an ENT specialist. And the other issues when the child has other complaints such as nose blocks, headaches, any other symptoms of infection, or any polyps in the nose, or this bleeding keeps happening again and again, recurrent, and it goes on for years, and that's the time you should see your caregiver.
Thank you so much, doctor. I think this is so vital, especially the part when you said that you sit upright and go lean forward and not go behind.
That's correct.
That is a very, very important, vital takeaway for a lot of people who are watching this video. Thank you so much for your time and this interaction.
Pleasure.